Welcome, everyone, and thank you for joining us for our final Population Mental Health Forum for the fall semester. My name is Christina Cordy, and I'm covering for Karsten Conan today. Before we get started with the presentation, I'm just going to start with a few preliminaries. So today our session will be recorded and it's going to be available online in approximately 48 to 72 hours. During the presentation, the chat feature will be used to share various links. However, it's going to be disabled for audience member use. Instead, please be sure to use the Q&A tool to post your questions for the Q&A session that will be following the presentation. So today I'm excited to have Dr. Zeina Kamali joining us, who will discuss disasters, brain health, and resilience, the case of Lebanon. Dr. Kamali is the director of the Neuropsychiatry Clinics and Fellowship and Unit Chief at the McCann Center for Brain Health at Massachusetts General Hospital. She is also an associate professor of psychiatry and neurology at Harvard Medical School. Her clinical interests and expertise revolve around the practice of neuropsychiatry, behavioral neurology, and brain health. She has conducted fieldwork in underprivileged regions, particularly in East Africa, Uganda, and Lebanon. And she has advanced brain health training to mid-level professionals in Ethiopia. She has also established a dual neurology psychiatry curriculum for the University of Hargeisa. She has also been active in the humanitarian field following the Syrian Refugee Crisis. And now I will turn the forum over to Dr. Kamali.
Hello, everyone, and thank you for having me today. I mean, it is very heartwarming to do this HSPH forum, and thank you, Christina, definitely for thinking of me. For many reasons, I was an HSPH student for my master's between 2006 and 2008. So it's always very good to come back to give a talk there, even though it is virtual, and too because the subject is literally Lebanon. So I am going to start sharing my slides. I'm hoping that everybody can see that. So we're going to discuss the case of Lebanon today from a disaster, if you want, point of view, but through brain health and resiliency and other stuff that get omitted at times from titles just to be very positive. But I have nothing to disclose besides saying that I was born and raised in Lebanon, and very proud to be so. I left in 1992, right after the Civil War, to come to the US to do my training. And so today we're going to get through an overview really of the multiple disastrous situations that Lebanon has faced in the past 10 years. The Syrian refugee crisis that came on top of the Palestinian and the Iraqi refugee crisis from earlier years, the unprecedented economic hardship that continues to worsen day by day, the COVID-19 pandemic, and obviously the disastrous, very catastrophic Beirut port blast that happened on August 4th, 2020. After we go through that, I'm going to navigate programs that we have offered from our program to theirs, and really with some emphasis on trauma, brain health, and resiliency. So Dr. Galaye, who actually had a great article in the Harvard School of Public Health in the fall, has coined as, like others, syndemics. So, and Lebanon is probably the best example for syndemics, which is you have multiple catastrophic events at the same time, right? So you have displaced people, you have refugees, you have increased poverty, you have COVID, and you have the port blast that basically occurring together. They get people closer to their breaking point. They cannot recover, or with a very, very slim chance of recovering. And then rather than just feeling struggling, overwhelmed, it's right a shift to crises. I mean, we have had some syndemics here in the past couple of years in America, where you had the COVID-19 pandemic hit with the disparities and the issues with racism happening together. So this would be another example of syndemics. The reason why we say they are syndemics, that syn part, is basically because I mean, together, they feed into each other, they augment each other. So the sum of all of that is not 1 + 1 + 1. It becomes really very close to infinity, if I may say. So the Lebanese economy used to be an economy that was independent, flourishing, but as you see over the past 10 years, 12 years or so, they went from a positive GDP of 8 to a -12, and actually in 2021 might be -15. Those graphs that you see here, for example, with the US exchange rate $1 to 8,000 to 9,000 Lebanese pound was yesterday 28,000. So it is literally a free fall and snowballing to pick up a lot of public deficits, a lot of people that are now unemployed and living in poverty. So the breaking point actually also in Lebanon, and we see that it's not only in Lebanon, right? It kind of is the same idea in other places. We have seen it with refugees fleeing Myanmar to Bangladesh. They made Bangladesh, already a poor country, poorer, and the refugee situation was even poorer in Bangladesh than they were kind of anywhere else. So having said that, the problem with Lebanon, it is a small country, but it is one of the top 5 refugee receiving countries in the world, right? So to the point that you have now almost, I would say, half and half Syrian refugees to basically Lebanese refugees. And with the Syrian refugees counting also the Palestinian refugees over 2 waves early on, and then also some of the Iraqi refugees that came to Lebanon. So this is very important. You can't really get a country to flourish when you have that. That is happening. And then some of the World Bank actually staff estimates that stopped by 2014, but they did not basically put them out, is you see in blue how Lebanon would have fared without the Syrian conflict crossover, and then what has happened since that conflict actually starting in 2011 and continued to our day. So this is huge, and really the Lebanon could not absorb that. And some of the multinational actually did help, although I will talk about it later, for a short period of time, and then turned it to local. There's a huge corruption issues in Lebanon, which is like a chapter by itself. So the people are getting impoverished, and there isn't anything done in that regard. On top of that, the refugee crises, Lebanese being very welcoming, everybody on board there. And then over the past 2 years, the SARS-CoV-2 pandemic hit. And like I pause a little bit because last year around Christmas time, a lot of people came back home to Lebanon. And right after they arrived from everywhere in the world, basically the cases start ticking up, and there were like a lot of casualties right after that, December, January, February. We do know that there is 8,800 deaths between that period of January 3rd to just a week ago. At 600,000 plus of confirmed cases. The Lebanon government has done well into the vaccination. So at least this 4 million include actually at least somebody having had only 1 shot. Those are not fully vaccinated people. But as you see, and now kind of with the Omicron, people are very concerned that this is going to tick up again. And be like last holidays, last Christmas, when things went very bad. And why I'm bringing this up is like you have all of those disparities, all of the background to make actually SARS-CoV-2 manifesting as severe COVID. You have medical issues. There is a very, very scarce healthcare resources now. Lebanon was really, the pride of Lebanon was very good education and very good medical schools and doctors. Many are leaving because there is no way that they could sustain there and their family. You have the economic issues. You have a lot of social issues. People are losing homes. Families are gathering together just actually to help each other. And that can increase the SARS-CoV-2. But also the outcome of that is also going to be even higher and get the Lebanon again to that breaking point in that syndemics that we are talking about. We're seeing a lot of food insecurities with or without SARS-CoV-2. The problem, though, is this is not the end of the story, right? It's not the refugees. It is not the COVID pandemic. It is also on top of all of that, the economic meltdown. So this is really very bad. The shelves are empty. There is no electricity. There is no medication. I mean, every one of us that leaves anywhere in the country to go back home, our luggage is literally all medication for family, friends, people we know, because there is nothing on the shelves. If you have parents back in Lebanon, they have worked all their lives, basically. They can't get a penny of any retirement money, any money that they have had put in the bank, nothing. So it's really a lot of things and that are happening even into the sacrosanct stuff of everyday life. At times there is no a gasoline for the car. Other times there is not even enough fuel to get, if people get like some generators, all of that. So it ends up being really very like that dignity is stripped off of everybody. And I have to put a point to the elders because they have seen it all. They've seen so many wars, so many invasions into Lebanon, and that was really what made it very bad for them. So this is again to say how much this GDP per capita has fell. You do see those very brutal contraction, like literally almost cut in half, if not more, associated with conflict or wars. The problem in Lebanon is you are living a daily conflict and a daily war every single day. Not really to take pride of that, but by now, actually, the economic crisis in Lebanon is top 3 most severe globally since the mid-19th century. And then came the unspeakable, right? So August 4th, 2020, there was the big Beirut port blast. So again, just I want you to figure out how many factors we are adding to that syndemics. And how powerful was the Beirut explosion? If you put the little boy of Hiroshima, which was a nuclear bomb of 15 kilotons, and its effect over there, Lebanon as a non-nuclear bomb actually was a 1.5 kiloton. So it was a huge bombing. It was disastrous. Multiple people died. This is the area of the widespread destruction. This is where the blast happened. You will see along the way multiple hospitals that were completely destroyed while they were getting patients in. And the rest of the area is heavy damage where like the whole city of Beirut was literally flattened. There were no more houses. People were on the street. So this is non-acceptable, actually, to be able to live through those tragedies and continue really living as if after this happens and then everything else shifts, as in life has to continue as usual, and it is not. So this is immense. And what has happened during that explosion? So this is what you see now. If you are in Beirut, this is the site of the explosion. Those are kind of the chaotic moments in hospitals where actually what ended up happening is the first flux of patients had mild injury that came in. very quickly overflooding the emergency rooms. So those people had to be moved, and very quickly something needed to be initiated. So everybody with like mild injury were literally treated in parking lots, because right after that, within hours, then the hospital started receiving the moderate and severely injured. Again, those hospitals were themselves into that area of the blast. So the amplitude of the blast really created 6,000 casualties. The hospitals everywhere were at full capacity. Multiple regular floor admissions, 130 ICU admissions, 200 deaths, 475 operative procedures. As I said, the EDs were overwhelmed early on, so there was effective triage to get people really treated outside, which saved a lot of lives. It reminded me really of the marathon blast in Boston, where that very rapid, effective triaging got people to live, and you were in very good city with good hospitals to happen. The same stuff happened in Beirut. Otherwise, it could have been a major, even more important catastrophe. And what it was learned over time, and is to have really key hospital functions like labs and OR in the underground. The good news about that, I mean, not that good, is that Lebanon had always had operating rooms in the underground from the time of the civil war, as well as all of the invasions we've gotten, because putting them really up top, you don't know what will happen the next day. So there is always something going on in basements, and a lot of OR tables are there. So the other thing that also was learned is you need to go back to really what we have learned during wartime. So during wartime, we did not have electronics. There were no iPhones. And people were able to, it was a very severe war that we were into for years, both civil and also with Israeli invasions and stuff like that. So you had to like really go back to the drawing board and do things very concretely. And it helped a lot in the Beirut blast, because guess what? The iPhones never worked. You could not get Epic. You could not get stuff like really backup in a hospital to keep it going. So you needed to go back on, everything is done manually. You like use your chutes, you get people basically to run in between places to be able to help people. So this is another publication that was just done and published. And Dr. Kaafarani is one of our associate professors of surgery here at MGH, but he does a lot of trauma work and in Lebanon. And so this was the best assessment that they were done into multiple sites, multiple hospitals, and trying to say that a lot of casualties came in, mostly in the beginning mild, and then came the moderate to severe. 30 had died on arrivals or just in the ED. The average age were all young people, 44.7 years, between 1 week as really infants to 93 years old. Almost half and half, I would say, male to female, perhaps 44 to 56. The median injury severity was around literally moderate. And that injury, actually, the more you are distant from the blast, the better you've done. A lot of head, face, and neck, as well as upper extremity injuries as well. The problem, though, is that it happened in the middle of COVID, right? August 2020, if you could remember, we did not even have the vaccine. So all of that happened through then. And this is exactly what happened. So you had a massive casualty. You had to take in people into hospitals that were already themselves shattered by the blast. People, of course, if you are really trying to save people's lives and holding them to get them to the hospital, you're not going to be putting on masks. Later on, masks actually also helped with the cleanup. They weren't through like the CDC guidelines. So you could see that the Beirut blast was there. And that was the joint point, and things took over on top of the blast with COVID-19 cases now renewed as well. So that's why I think Lebanon is that breaking point, right? So in the beginning, you try to be very positive and get going, but what you are seeing these days in Lebanon is learned helplessness. Those are people that are just sitting there, non-reactive. People feel that they are accepting everything. It's not that they are accepting it. I think there is this giving up reaction that no matter what we do, nothing will work. And this is very hard to address because very few people actually try to link it to this trauma, multiple traumas, and moral injuries, right? So we cannot take things happening in vacuum. And humanitarian agencies that come in basically with a first aid kit, with a band-aid. They do a little bit of everything, and then within that humanitarian space, and then leave. When actually in that humanitarian space, I think we have to have a shift to talk about moral injuries and trauma from the beginning, solve structural problems, help with every single day transgressive acts, right? So the Lebanese now have lived through a lot, they've witnessed a lot, and it is for them grossly disturbing and inhumane to basically even with all what they have seen, just think about, oh, the world is a good place to live in and people are there to help each other. And that internal conflict creates a lot of that moral injury with outcomes such as guilt, demoralization, lack of motivation, self-handicapping, self-injury, you name it, mental health issues. And I am not talking about PTSD there. I'm just really talking about this moral injury that we, in a humanitarian space, we have to start getting to address because it's very important. So from a doctor that is doing brain health, why do I care so much about all of that? Is because we do know that all of this syndemics, all of those trauma, all of those stressors, all of COVID-19 and post-COVID-19 is going to create a lot of neuroinflammation, which is going to affect the brain very negatively, whether it's today, whether it's in 2 months, whether it is in 5 years. We do know that from previous research done on, for example, adverse events of childhood, right? And people quantifying those and knowing that if you had more than 4, you're practically, no matter what you could do, you're doomed to have a lot of other issues. And so cardiac, brain, mental health, all of it together. So this is very important to keep in mind. We need to do anything that we can to try to decrease that neuroinflammation and get back this control. And that's why I say we need to aim beyond the band-aid. And this is very important. It's not only to come and try to see where people need to be living, put up tents and just help with a little bit of clothing and food. This is way beyond that. It's really community support group. It's empowering families and neighbors to be there for each other. The WHO got it 20 years later. So now they have this revised version that includes justice, disparity, all of that, what we are talking about. And through the GMH MAP project, for example, it's good to provide first and foremost basic needs, but then you need to be able to work in that space, that community and family supports with the psychosocial resources right then and there, again, to try to decrease as much as possible that inflammation by creating secure attachments. This is very important. And then out of there, if you are lucky, then you can push forward to non-specialized support and specialized services with psychiatrists and social workers, et cetera, et cetera. So the field work that we have done, and I speak for very many people that joined me in that work, has spanned like years really of my life. whether it was refugee work, whether it was dementia awareness work, education work, way more. We tried to do a lot of traumatic brain injury assessment work, empowering women, so all of that. But I'm going to really focus on those three for today. So the first one is the SMART program adapted to the Lebanese refugee crisis. And the SMART program is actually a product of the Benson Henry Institute, which it stands for Stress Management and Resiliency Training Program. The Benson Henry Institute, they were very generous. They accepted that I actually take the SMART program, translate it into Arabic, and adapted to the Lebanon refugee crisis. And this is what we've done. So it was a team effort between the Justice Pierce Division of Global Psychiatry, the Benson Henry Institute, as well as the Ministry of Social Affairs in Lebanon. And the whole training was to train 100 social workers spread throughout the country from north to south, into basically being able to be certified in the SMART program for two reasons. One, for themselves, for self-care. Those are the people that were taking care of the refugee population and the Syrian refugees influx, but also to be able to adapt the SMART program in refugee camps and be able to help the Syrian population as well. So it is a bit adapted through a lot about trauma and loss, which maybe if you're doing the SMART program in Boston, you may not do that. The exercises are exactly the same, and then elaborating on positive thoughts and emotions and the automatic negative thinking were all the same. And this is what we got. This is the N of 100 that I am talking about. At that time, I was almost in country for like a couple of years trying to do that work, doing the support for the Ministry of Social Affairs. I was involved with those social workers, with field work in the camps on a daily basis. And you would see more female than male, because again, as a social work profession, you do see that changes here also in America. And over time, what we followed their blood pressure, we followed their pulse of those social workers, and we did kind of a stress index, which is the SCL-90. And over time, what has happened is the mean ratio scores went down between time 1 and time 4. Those are at 3 months interval. Their blood pressure went down, their diastolic pressure went down, the pulse went down, so they felt better. I have to say though that for people with an SCL at the start of greater than 64, those are people that it's beyond just coping with stress. For the depressed people, the SMART program is not a treatment program, it's a supportive program that can help, so you will need something else, but at least they were doing better over time, and they were referred for treatment of mental health. Those are the 50 commonest words that we were able to really compare between when they were asked, what are the words that come to mind when you think positive and when you think stress? And so you would see like stress, decrease, irritability into all of that, versus the positive thinking. The away came with stress. They wanted to really go away, not be doing what they were doing. And the same thing we've done about expanding and continuing practice. So people really did not want the SMART program to stop. They wanted it to continue forever. It helped them a lot. They wanted to use it, disseminate it, continue on the program, train other people, bring it onto the workplace, work with children with the SMART program. It was really great to see. And then a lot of people started really incorporating it as a way of life, right? This is not only beneficial for them, in the program that they were doing in refugees, but interpersonally, people felt better. They practiced, they had self-confidence, they were able to have this benefit also at work, benefit the refugees too. So within that SMART program, though, as training the social workers and doing field work, one of the field work we have done were actually with elders, with elder refugees. They were all Syrian at that point. And we would be going to them to basically just be present and then introduce the SMART program meditation part. And part of that field work was actually a questionnaires to ask them what resources were offered, what they were lacking, what they worried them, as well as continue to follow them on a cognitive and mental health resources. And pretty much the basic needs were there. They were lacking a lot of medicine for chronic diseases. Those were not covered, neither by UNHCR, and Lebanon could not cover it at all. But what the elders were very worried about is really getting sick and dying in exile. This was for them really unfathomable. The other stuff that you also have to think about is really what happens in war and in refugees, and when you flee one country to the other. The most important stuff is that the family is dislocated completely. So that elder that in the Middle East is really the patriarch of the family is now in a refugee camp, trying to be the protective figure for women in the camp, family members, women, because also sons and younger men were left behind on the battlefield. So this is a lot to take on. And many of them were not very educated. Some of them actually were completely illiterate. So it was a lot to maneuver. And more than 50% of our group actually got depressed, which affected their cognitive day-to-day functioning. We did also capacity building for Alzheimer's disease campaign. This was a bit, I would say it came a little bit before the refugee crisis, but it actually moved forward with all of the refugee and SMART program that I was telling you about. And it's basically to take something that we could make culturally appropriate to raise awareness for Alzheimer's disease. I worked at that time with Alzheimer's disease Lebanon, but also to train caregivers about what to do. And all of that through the social work, like now network, right? So those are people that I call family. I've known every single person of them. And again, because their network is very wide and they are there on the ground, then I was able to do this Alzheimer's disease awareness campaign also over a full year from the north of Lebanon to really the south. And we tried to stress on things that are meaningful for the Lebanese. So if an elder is not able anymore to sit at the table and eat with the family, this is way more significant as a sign of something is happening neurodegeneratively than perhaps just having word finding difficulties, right? So all of those things are very important to target culturally. So you could do a lot of dementia prevention. You have those great, like newly published manuscripts about dementia prevention, about what we could do. A lot of them, of course, could be great to do, but you need an environment and social economic factor to be able to address them. All of that is addressing neuroinflammation, but this is the basis. If this is not there, if you are in a syndemic that is never ending, it is very hard to basically push through it. We've done work as correlates of stroke in Lebanon to really find out that it is the second leading cause of death, but that also it was part of that syndemics, right? So now you have COVID, people had strokes, did not go to hospitals, you had the Beirut port explosion, et cetera, they stopped seeing their primary care physicians, blood pressures were skyrocketing because of the economic situation, they could not get their antihypertensive medication, and so on, so on. On top of it, of course, Lebanese do smoke a lot, and also do the nargile and the shisha. So that becomes even more problematic. So there are things that they could be lifestyle changes, modification that could happen, but actually there are also other parts that were even more aggravated by this syndemic. The traumatic brain injury, concussion, same thing, right? So Lebanon is on that map where it doesn't say much what's happening, like the gray area in every other places in the world where traumatic brain injuries are underestimated, underreported. A lot of them are due to motor vehicle accident against a pedestrian or against a driver, or then domestic injuries and then sports injuries. So you see here the risk factors. Kind of, we did this review through MENA to really find out that they kind of have some commonalities there. This is not in Lebanon, but I love this picture. This was actually a traumatic brain injury campaign done in Sankar, and this is one of the activists. And I always remind people that you have to do something, right? Because this is what happens. People are killed, or they have continued traumatic brain injury that you cannot see, but they are suffering from for a while. And finally, to keep the last minute, I mean, this is probably the most beautiful campus in the world. This is the American University of Beirut. This is where we all graduated from, came to, and we have put ourselves together, a lot of those Lebanese medicine graduates, to basically try to help out because of the brain drain in Lebanon. Residents at this point, whether they are in neurology, psychiatry, internal medicine, pediatrics, you name it, are not probably getting what they need from didactics, from case discussions, from mentoring. So here we are, a group of doctors all together, and are launching this residency education programs over Zoom, meeting with the residents on a weekly basis to do all of that. And it is just our way to say thank you for everybody there. And with that, I'm going to actually finish to open to questions. Learned positivism is the same way, kind of as this learned helplessness. So Fred Rogers, with this great show of Do You Want to Be My Neighbors, actually is one way there. That also shall pass is part of the SMART program, is another way there. I know that saying those things is kind of cliche because of the people living through all of what they are living. Is hard to fathom that actually, yes, they need to learn this positivism. I would say, however, that probably if positivism is hard to get, perhaps being present for other people is a huge impact onto their lives. You may never know how much that is, but I think this is one way of just doing it one day at a time, I guess, and moving forward through it all. And with that, I'm going to stop and open it to question, and thank everybody for listening and for bringing the Lebanese syndemics basically at the forefront. Thank you.
Thank you so much, Zaina. That was a really wonderful presentation, and I really appreciate hearing about all the work that you've been doing. We're going to go ahead and open up the Q&A, and so for all the attendees, if you could go ahead and post your questions to the Q&A box, and I'll be going through and asking them to Dr. Kamali. While we're waiting for people to get some of their questions in the Q&A box, I'm going to start off with one of my questions. So you've spoken a lot about some of the work that you've been doing and a lot of the a lot of progress that you've made just on the ground with the field work and everything. And I'm wondering, what would you say are some of kind of the next steps? Like where should, if there's something that the government can do or just people that are on the ground, what would be the next steps for trying to improve, I guess, continuing to build supports among field workers as well as just the population in general?
I think the next steps is at least through the humanitarian work and the humanitarian space and with field worker, is really to check the pulse and be able to sit with that, with the learned helplessness and the moral injury part that is happening, try to process it so people can actually process what is happening and be able to move forward a little bit, maybe 1 inch at a time, because otherwise I don't think it will help just to feel that okay, let's go down and try to see how we could be helpful very briefly and then leave. So people now are just, as I said, completely in that space where they are demoralized. You can't just give them false hopes for a couple of weeks and then leave the ground. So I think it needs to be community work, long term, and it doesn't need to be through the Lebanese government. I mean, the corruption is huge. I don't know what they could do through that, but it could be through institutions, through perhaps people to people, through like good people, let's say, with connections at the Ministry of Health or the Ministry of Social Affairs, people that you already know, that you have forged relationship with, to basically do that work. Because I think unless that work is done, a lot of that positivism and let's continue, and I mean, is not going to happen. The system has taken a lot to basically be very fragilized and explode, that you have to rebuild anew as you acknowledge affect.
Okay, thank you. So we have a question that goes kind of hand in hand with what you're just talking about, and you kind of already partially answered it, but I want to propose it anyway. So how does one teach positivism when the daily lived existence appears to contradict that on so many levels?
So the best way to do that in Lebanon, let me just talk about that, because I mean, it could be in different countries, might be different, but in Lebanon, I think the base of Lebanese people is family ties, people looking after each other and looking after each other over a very good meal. And I think it could start there. It could be as basic, as concrete as theirs. So to basically be able to form again secure attachments within family members, within friends, supportively around basic attachment, which is food, but just start there. And from there, it's a space to open up to more things to be done. And then maybe having more people around that table and doing more projects together within the community, just small by small, and then literally just focusing on this hour, this moment. There is still very good people back home that are trying to do the best they can just to survive and help others. So I think empowering them to do more, having people from outside and in the diaspora help out with any program they can volunteer for, pick up people, form attachment. This is also very important.
Okay. So we have a comment and another question that's, thank you, Dr. Kamali, for systematically breaking down the humanitarian crisis in Lebanon and your dedication to the work. Many of us here are public health practitioners and doctors who are either Lebanese or have close ties to the country, hence the intimate understanding and connection to our land. How would you best advise the upcoming health practitioners to address the crisis at home, such as this pushing for secure attachments, which you've already talked a bit about, and where does one begin, and how do we keep elevating the issues of this syndemic?
All right, so I'm going to start with the easiest one, which is the last question. So the issues of the syndemics have to be written about, shouted at. I don't know, I mean, just people need to know that this is not only one thing that got us there, but that is a lot of things together. So I think acknowledging that as loudly as you can. Spreading the word, I think, is the way to do it. So that is number one. The secure attachments as doctors, right, is the best secure attachment to get patients to do better is what you do into that secure attachment between a doctor and the patient. This is when you are really healers beyond what you give medication for. And I think you could start there. On secure attachments, I mean secure attachments between two human beings first, and then it can, then they grow some self-confidence. Then you could get them to get a bit out of that learned helplessness to really get bigger and be able to address, I would say, system issues. But that attachment as public health providers and as doctors really starts on your one-on-one, and then you could spread it out to the community. And when the more you're present, the more you're empathic, people will sense it, and it will get you really a long way.
Okay. So our next question has to do with kind of resources within the government. So in terms of thinking of, whether the Ministry of Social Affairs or the Lebanese MOPH, if they have sufficient resources to actually address this endemic, and if not, what are some other resources that might be able to be used, such as the World Bank funding, donations from other partnerships or public health institutions?
So, I mean, kind of yes to all of the above, but in Lebanon, there is also a major corruption that is happening and then it becomes really virtual money. So you have money donations that come in to X, and then you're looking at Z and there is nothing. And you tell yourself what happened, and you can never know what happened, because it goes into that virtual space and it gets sucked out literally. So the Ministry of Health and the Ministry of Social Affairs, I think they have something very strong, which is the human element. I mean, people are not paid well and all of that, but there is the human element that is there. And I think when people start thinking about how we could help, I would say it should be through direct, maybe NGOs connection, maybe direct academic institution that is happening, involving people in the Ministry of Social Affairs and the Ministry of Health. I am afraid to say all has to go to this government top down, because it has come that way and nothing has happened on the ground. So I think we have to be able to get another space where academic institutions, NGOs, people forging person-to-person, basically interaction that can lead into more things to happen should happen. Consulate services of other nations that understand what is happening can actually put in more initiatives, more money initiatives to be given directly to the people on the ground, right? Grassroots work, because that top-down approach in Lebanon is not working now, has not worked very well, but presently in this level of corruption is not working. So it has to be really that help, the help to the people directly.
And there's a follow-up to that question, which was also, do you think the upcoming elections hold promise for some sort of reform in Lebanon?
I would hope so. I don't know. I always say that maybe if there is even a breakthrough, I don't think it's going to be a major uphaul, but maybe if there is a breakthrough of other people there, maybe a change will happen. Remember, change needs time to happen. It might be over 10, 20 years, 30 years sometimes. It's not one election that is going to do it, and most likely not this one.
Okay.
Yeah.
And what do you think are the most important skills mental health professionals need to deal with these syndemics?
I think a good training in trauma is very key, like trauma work. trauma work to heal people or to get them into the right spaces that they need to be to get healed and treated. I think family work is very important. Occupational work, as in, I always even tell my patients here, is maybe put in 4 hours of meaningful work during the day so you could start feeling better. Whoever that person is that you are dealing with, I would do the same. So I think, and I mean, as I said earlier, just securing this attachment would be key. But for people that do a lot of trauma work, they understand where this is coming from. Securing this attachment, sitting down with the affect is going to be key to continue. Because again, the effect on the brain is huge over time as well. And so you want to really try to mitigate as much as possible.
Then we have another attendee who's interested in hearing your opinion about how to manage promoting resilience and adaptation to daily life, and also to kind of continue to see all that is wrong and have the energy to fight for basic rights. Essentially asking how do you manage such balance within this context?
Yeah, well, sometimes it is not about managing the balance. Sometimes it's just about coming as you are and just also being present, as in having this learned helplessness yourself, right? So it's I mean, the SMART program is, for example, a great tool for adaptability. But then when you are really facing a huge, as we said, syndemics, might be hard. But I think as a practitioner, we don't need to also put up that face as if everything is all right, because it is not all right. And I think just coming on with that, with our vulnerabilities to that space with people you're working with, is already a step forward, because this is how people actually start trusting and open up a bit more. And this is where you could work on that moral injuries, which, by the way, is a huge, not only in the population, is huge within like professionals, doctors, nurses, social workers. I mean, this is where you see it all, right? It's, you see it and you can't do much about it. This is the clash on that moral injury, right? People are, they're coming there, you can't do much. And I say being present with your vulnerabilities, with our weaknesses, to say it is too much, we cannot take it the same way as you are, but how we can just secure that attachment together, I think is one way. Of course, there are probably multiple ways, but I find this way, I have practiced it in all humility, and I think it gets you with time somewhere with people you're helping.
You had spoken a bit about with the individuals, I think the social workers that you trained in the SMART program, and how none of them wanted the program to end. And I'm curious whether you were able to pursue any sort of train the trainer initiatives or any way to expand on the program to make sure that it was kind of continuing to be implemented or expanded.
So we did in the trainers initiative with the SMART program, and then so we keep the connection going, as in how they are doing it with other programs they are undertaken. I mean, with COVID, I couldn't travel that often and that much as I used to, so that is part of the issue. I'm going back to Lebanon probably in February, March, and then I will reconnect with other people. But yes, we did follow it up with Train the Trainer program. Yeah.
And we have an attendee who is wanting some suggestions for staying up to date on public health interventions in Lebanon. For example, wanting information about certain institutions to follow, or books, or different journals where they can find some of this information.
I think, I mean, being up to date is really being able to keep, I mean, you're not going to be up to date on everything that is happening. This is, I don't think it will happen. And so not to be disillusioned by that. I think what you need to do is perhaps read more about trauma, humanitarian space, and then pull in Lebanon in your search. And this is where I think I would start. The Harvard Trauma Program, for example, they have a lot of tools available on their website that you could also check. They give a course yearly. People could also apply to participate in. There are a lot of sometimes pop-up programs through the Red Cross that can also happen. I think you may want to be more in touch with the Ministry of Social Affairs, because they also know, part of the Ministry of Social Affairs, I don't know if you know that, they have a huge section on NGOs. So they could also, like, I would say, get you to couple with an NGO that is doing kind of what you have in mission, and work with them and get to know them better and get to know what they are doing. The Institute of Global Health at the American University of Beirut is doing a lot of great work around conflict and medicine and public health. Those are other people to think of as well. So this is where I would start.
Okay. All right, so that's about all that we have time for today. So Dr. Kamal, I just want to thank you so much for joining us today. I really enjoyed your presentation and learning more about the crisis that's been going on. And I also want to thank everyone for joining us. So we will be posting this recording to the HSPH YouTube channel, as well as the HSPH website. And that'll happen, it varies, but generally about 48 to 72 hours. And this will actually be our last forum of the year, but stay tuned for our next forum that will take place on February 16th at 11 a.m. Thanks, everyone, and happy holidays.
Thank you.
Bye.
Bye.